This is my health and information education. I will be looking over a 30-year-old female. Her name is Miss Elizabeth Johnson. Hello, are you Miss Elizabeth Johnson? Hi, my name is Crystal. I'm one of the providers here for the dermatologist. I understand that you have a facial sore that you said that's been here for a couple of months and you're concerned about it? Awesome. I was just wondering if I can take a little closer look, okay? Won't do anything, won't be tampering with anything. Okay, well, I'm not 100% sure, but let's just go ahead and figure out what we can see at the moment. It is very possible you are 30 years of age. You've been out in the sun a lot, that's correct. Okay. So, what you possibly could have is a type of skin cancer. It's very common for people that have been outside a lot with no sunscreen or protection, especially over the years. It just, puts on top of it. It's nothing to be too concerned about. We think we've got it at a good time, so we have plenty of options to go from here. There are a couple possibilities of the type of skin cancer you might have. One of them is called actinactic keratosis, which is a precancerous formation that develops over time with not having sunscreen on, of course. The other one is called melanoma. It's a tumor that develops underneath your skin and that goes to the top layers of your skin, so you'll be able to see like a little bump like the one that's on your face. It could be that, and there's different types of melanoma. You have the carcinoma. You have the carcinoma, which is from under the skin. You have epithelioma, that's from on top of the skin. So from here, what we would like to do is we would like to biopsy it, and that means we take a small piece of the bump on your face, and then we send it off to lab for evaluation. And from there, they will determine if it is cancer and if it is, what type it is. Then from there, we will notify you, and then we will give you your treatment options. Those will probably be chemotherapy, which is a drug treatment that's intravenously, which means it goes through a vein in your arm through IV. There's also the radiotherapy, which we use radioactive materials to get rid of your cancer cells. And then we also have the debridement process, which we take a scalpel and we just cut it out, and then we go from there. I would like to talk to you about prevention and self-examinations from here on forward to help catch these things early on and to possibly prevent any more damage to your skin. So at the moment, do you have any questions for me? No? Okay. So we're going to go ahead and talk briefly about monthly examinations, okay? So the best time to do it is after you get out of the shower, just once a month. Go ahead and do a full head to toe examination. Look at all, go ahead and look up and down your arm very carefully, because that's probably where you're going to have most of your melanoma, because that's where your arm has the most exposure to the sunlight in your face. So just go ahead and take a quick look. Just make a mental note of your moles that you have now, any bumps or bruising, just to make sure that it doesn't turn into a mole, because new moles actually sometimes come up red or like a bright pink. So some people ask, what is that bump? It's so weird. Well, if it's like a pinky one that looks like a mole, it's a new mole. So you just want to keep a close eye on those ones. So just go ahead and take a look from head to toe. Have a spouse, significant other, children help you. Look for things. If you've noticed anything new do, go ahead and note where it is, how big it is, when you noticed it, and write those down. And then next month, look at those again. If they've gotten bigger or they've changed shape or color or even moved positions that you've noticed, please give me a call. We'll get you back in as soon as we can, and then I will evaluate it and we'll go from there. Okay? Any questions on that? Okay. So now we're going to go to preventing. So I know you like to be out in the sun, which I'm okay with, but if you could please, please, please put on some sunblock. It will keep your skin protected. It will make your skin not only younger, but it'll stay protected, like I just said. And you won't have to worry about having any more bumps or new moles coming in, and it'll just nourish your skin, and it will help prolong the life of your skin as well. Okay, so Mrs. Johnson, if you could please verbally tell me how to do a self-examination from head to toe for me. Awesome, awesome. So it seems like you definitely understand your physical head to toe and your precautions. Gotta have your precautions. And so we will go ahead and get your biopsy ordered, and then we will go from there. If you have any questions, please get a hold of me. Thank you.